If you have ever felt insecure about your body, you aren't alone. Today, we are separating medical science from marketing lies. Today, we are answering age old questions. Is size actually matter, or it just you are being targeted by a multi-billion-dollar industry? To fully understand this, we make this video in three parts. First, female reproductive anatomy in simple terms. Second, what AUA thinks about enlargement or surgical enhancement on penis. Third, what life partners think in long-term relationship. When people say female reproductive anatomy, they are usually talking about the vulva, vagina, and the parts inside them. Everyone's vulva looks a little different, but they are all made up of the same basic parts: labia or lips, the folds of skin around the vaginal opening, clitoris, a highly sensitive gland that makes sex and masturbation feel good. The tip of the clitoris sticks out at the top of the vulva. The rest is inside the body. Clitoral hood, a fold of skin that is part of the labia. It covers some or all of the clitoris. Opening of the urethra, a tiny hole that the pee out of between the clitoris and vaginal opening. Opening of the vagina, the bigger hole between the urethra and the anus, which leads to the vagina. Mons veneris, aka mons pubis, the fleshy mound above the vulva. Now you know what female reproductive anatomy looks like and what is what. Clitoris is the primary source of 80 to 90% women's pleasure in the world, and there are other parts also. Now, the profit machine. How the industry fools us. The American Urological Association AUA and the Urologic Care Foundation states that cosmetic procedure for penis enlargement such as subcutaneous fat injections for girth and cutting the suspensory ligament for length have not been shown to be safe or effective. They also warned that over-the-counter enlargement supplements and pills do not work and lack scientific proof. Official AUA stands on surgery. As I said previously, fat injections. The AUA considers subcutaneous fat injections into the penis to increase width as a procedure that lacks proof of safety and effectiveness. Suspensory ligament division. The AUA notes that cutting the suspensory ligament to gain length in adults is unproven for safety and efficiency, and it can result in structural instability or deformity during erections. Medical exceptions. The AUA and the Urology Care Foundation emphasize that legitimate surgical intervention is only indicated for true diagnosed medical conditions like micropenis, stretched flaccid length under 7.5 centimeter. Official AUA and medical stance on supplements. Enlargement pills. There are no scientifically proven or FDA approved dietary supplements, pills, vitamins, or herbal creams that permanently enlarge the penis. Safety risk. Over the counter male enhancement products are unregulated, carry unknown side effects, and may contain hidden active pharmaceutical ingredients or harmful contaminants. Now the question is, what partners actually prefer? Women's preferences for penis size may affect men's comfort with their own bodies and may have implications for sexual health. Studies of women's penis size preferences typically have relied on their abstract ratings or selecting amongst 2D flaccid images. This study used haptic stimuli to allow assessment of women's size recall accurately for the first time, as well as examine their preferences for erect penis size in different relationship contexts. Although they made more errors with respect to penis length than circumference, women preferred a penis of slightly larger circumference and length for one time and for long-term relationship. So as you see that women preferred only long penis when they want only one time, and for relationship the way you are is enough for them until your penis is less than 7.5 centimeter, or you can say micro penis. For that you have to seek medical advice. Now that you know that all of this is a lie from the industry to make billion dollars, how can you make yourself free from that? For that you have to make or build communication skill, confidence and techniques. How can you do that? First you can do is detach yourself from sadness and negativity. Second, after you wake up and before you go to sleep, only say good things to yourself. Second, start wearing the colors you like. Then everyday exercise, eat healthy food, meet good people and do something that make you happy. Second, communication. If you don't know how to communicate, then read books, then go out, talk to people, go somewhere where there are people surroundings, start talking with them, then slowly start talk to girls casually until you are comfortable with them. Then techniques. How can you build techniques? You can read books or watch YouTube videos, or there are courses. If you don't know how to do that or how to get that, I will give you a link there that I know of, and all the books you can buy books or download books and YouTube links you can check. Guys, if you think this video help you, please like, comment and share so that everyone will know, because anxiety is a very bad thing. It's not just going to destroy your life, it's also going to destroy your relationship. So stop worrying and enjoy your life. Good luck.